Thank you, Mr. Chairman. I just want to get some facts out, not in any partisan way. Your budget proposal, as you put it, reduces Medicare spending by $845 billion. You describe it as efficiency and reduction of waste, but is that correct?
No, it's not correct. There is a gross federal savings for Medicare line in the budget, but when you add back the proposals that we include for a uncompensated care pool outside of Medicare for children's GME, Medicare.
And what is the number when you add that?
The number is about $517 billion in savings.
So you're saying that it reduces Medicare spending by not 500 billion. The report suggests that 500 billion of this quote unquote savings would go to the deficit. You're saying it's less than that?
No. So right now, I thought you were asking about the number that has been reported in the press, $845 billion.
Now, what would you say is the accurate number?
The accurate number, again, we increase Medicare spending every year. This is not a...
Not a long answer. Just give me the number.
I'm providing an answer for you. $517 billion in savings within Medicare over 10 years is the net Medicare savings number.
So you're going to cut by $517 billion?
No, sir. Medicare spending, as I mentioned, will continue to rise each and every year.
Okay, but you're reducing the Medicare budget by $517 billion.
We are identifying savings that would result from common sense proposals like reducing drug pricing costs. Obviously,
have you endorsed the Doggett bill on that?
Medicare.
Would you be open to the Doggett bill, which reduces drug costs? I mean, I know you're saying let's reduce drug costs, and that's a great thought, but what specifically, how are you going to do it? So far, the president hasn't supported the Doggett bill. The president hasn't supported any bills. I mean, would you commit today that the Doggett bill, which actually could reduce costs, you would consider supporting that?
We'll certainly look at analyzing any piece of legislation that's out there as it pertains to drug.
Does the president have legislation on how he's going to achieve these drug reductions?
We do.
What is the legislation? Is there HR or Senate bill? I mean, what legislation is he supporting?
We're happy to work with Congress. We're hoping that Congress.
But has he proposed any legislation?
We have proposals that we hope you turn into.
Has anyone introduced the legislation?
We're working with Congress.
I know you're working. Then what legislation is there? I mean, there are thousands of bills introduced. Is there a single bill the president's introduced to be able to get the savings that you want?
Congressman, we don't introduce bills.
No, but you suggest bills. I mean, have you proposed? And you do. I mean, you wrote the tax bill. I mean,
we specifically propose policies that Congress can turn.
But you haven't worked with any single member of Congress to introduce any legislation to get this $500-some billion of reduction that you say you want.
I don't think that's true. I think that.
Is there a single member of Congress or bill you can point to?
I think the Health and Human Service Department has an active legislative office that is working to turn these policies into actual proposals.
I don't want to belabor it, but if you could maybe submit for the record what legislation we can get behind that would get $517 billion of drug cost savings. So far, I only know the Doggett bill. I mean, maybe there's some other magic solution. The other thing I want to quickly go over is you propose $1 billion of cuts in the National Science Foundation. Is that correct?
We have cuts to the National Science
I was with Secretary Condoleezza Rice the other day. She's near my district at Stanford. She said the single biggest thing we can do for the national security of this country is double our National Science Foundation. Would it be accurate to say the president would disagree with her characterization?
No, we have, in a time of $1 trillion deficits, we believe that $7 billion for the National Science Foundation is a very healthy budget. And
I know, but you would disagree with her characterization that we need to double it. By definition, you're saying we need to cut it by $1 billion, correct?
We think that the National Science Foundation is very important. We think
I get all that, but you would disagree with her characterization that we need to double the budget. I mean, your budget on the...
I had a conversation with Secretary Rice about this. I would just point out that the National Science Foundation doesn't need to be immune from looking at waste, fraud, and abuse. To the extent that they spend money on winemaking programs, they're supposed to be investing in science, and yet we still find that waste, fraud, and abuse is not something that they are free from. That's the conversation we want to have.
And you're cutting the National Institute of Health budget by $4.9 billion. Is that correct?
We bring the National Institutes of Health down to about $33 billion.
Do you see why, I mean, not trying to be partisan, do you see why some people may think that you don't believe in science and technology when you're cutting the National Science Foundation by $1 billion, when you're cutting the National Institute of Health by $4 billion, which the Republican Congress, by the way, increased $2 billion last time, and when you're disagreeing with people like Condoleezza Rice? I mean, do you see why that perception might be there?
I don't believe I understand why the perception would be there, because we look at the fact that we're spending $134 billion in research and development. That's exactly what we spent in the last 2 years. Now, we allocate it differently, but it's something that we prioritize a great deal.
Thank you.
Thank you, Chair. Thank you, Mr. Vaughn, for your testimony today. I wanted to talk a little bit about how your budget proposal is going to have impact on the millions of vulnerable children across this country. I wanted to tell you a little bit about the impact that I see that it will have, because I don't feel like you or this administration or Trump gets it. In America, 1 out of 5 children struggle with hunger. And for many of these children, the free lunch and breakfast that they get in school is often the only meal they get to have. Yet the budget that you're proposing, and this administration and Trump is proposing, makes a $1.7 billion cut from school meals over the next 10 years. A cut that largely would result in more than 29,000 children losing access to free school meals program in my home state of Minnesota alone. What this budget does is quite literally take food out of the mouths of children. How can these kids be expected to be present and fully present in classes, to learn in the same space as other kids? How can we expect them to reach their full potential? And how can we expect them to be able to be on the same footing as other kids around the world? I often say that budgets are a value statement, as you have many times in this committee. And you said that we are committed to having promises kept. What does this budget and your proposal in cutting the child nutrition programs say about the promises that we want to keep to children and where our values really are?
Thank you for the question, Congresswoman. We don't think that our budget cuts the programs that you refer to. Specifically, we think that it's important that high-income schools that are currently grouped together right now to receive benefits because they're grouped with low-income schools, that's unfair for the programs themselves. Similarly, some of the reductions that you've talked about are with regard to one-time rescissions that are not needed to be able to cover all of the children that we currently project. And we know Congress does the same analysis.
Yeah. How is the assessment made what child deserves to eat and what child doesn't? My understanding is that we should care about every single child arriving in that school, having the resources that they need to be able to get educated and be fully present. We have parents who might fall off the threshold of whatever that income is, who might not be able to pack a lunch or a breakfast or milk or a cookie or an apple for their kids. Should those kids not be able to have meals in the school so that they can be fully present in that classroom? Is that what this administration values?
We believe it's important that communities that are otherwise ineligible to receive these types of benefits not receive these benefits, and that only the communities that are eligible receive them.
But how is the judgment of what the value of the benefits is made? We are talking about children in our classrooms. We are talking about America's most vulnerable. Earlier, you talked about the harvest box. You said if they are not home, that they should pay a price.
No, I didn't say that.
That was the example you used, that if you're not home, then you pay a fee.
No.
So what penalty would you think should we propose for people who might not be home to receive juice or a cereal box or a canned meat?
I specifically was not referring to suggesting that they should pay a penalty. The point I was making, Congresswoman, is that we don't think that it matters where you are on the income scale to be able to determine a certain level of responsibility to receive in the mail that which you are expecting to receive in the mail. We think that human beings are responsible from that standpoint.
I get that. What I am saying is we have a responsibility to make sure that here in the United States, people are fed. We are talking about food. We are talking about children having food.
We agree.
We give humanitarian assistance to people around the world because we believe people should not experience food insecurity, people should not starve. But here in the United States, we decide to increase a defense budget that might lead to not having our budgets be fully intact, but we decide to say that we don't have enough money to feed our most vulnerable.
Thank you.
That is the decision we're making.
I thank the chairman very much and the ranking member. I thank the director for his presence here. We're all committed to the American people. But as I look up and raise up this budget that says for a better America, you know that I have a completely contrary view of this. In fact, I think this hurts the most vulnerable in America and people who have worked in America, seniors who have worked in America. And so I want to pose questions along those lines. First of all, I think it is important to note that the top 10% of America's population now average more than 9 times as much income as the bottom 90%. 9 times. Americans in the top 1% average over 40 times more income than the bottom 90%. The nation's top 0.1% are taking in over 198 times the income of the bottom 90%. That's a lot of people. And African-American families with just over $3,500 owns just 2% of the wealth. I don't believe that this budget that is interested in cutting from the very heart of the needs of people, from education to health care to the environment, $2.7 trillion, is seriously committed to working in a bipartisan manner to provide for the great America so that all people have the ability. My questions to you involve issues around Medicare, $850+ billion. How does that in any way make America better when you attack the most vulnerable?
As I mentioned earlier, thank you for your statement. I do believe that budgets are about our visions for the country. It is inaccurate to say that our budget cuts Medicare by $845 billion. We increase Medicare every single year. The savings that we include and assume in this budget is $517 billion. The $845 billion number that has been reported in the press comes from the fact that there's not an assumption that we are other places outside of Medicare providing for uncompensated care and graduate medical education at our hospitals.
Might I say,
if I might,
reclaiming my time, if I might, those kinds of shenanigans and manipulation may sound good, but it is accurate that there are cuts coming out of Medicare of $845 billion, almost $850 billion. Also, I want to take note of the fact that here's a president who engages with Russia, North Korea, wants to pull troops out of Syria and Afghanistan. So why in the world are you asking for $750 billion for defense, in contrast to the enormity of the amount of billions of dollars that you're cutting from education, environment, Medicaid, Medicare? What is the purpose of using non-defense discretionary, this statement of mandatory, which makes it sound negative, of course, from the very beginning? Why is that always the target when vulnerable people, from seniors to young people to minorities who've not had equal opportunities in many instances, as you've indicated, the income of African Americans, to the contrary of this administration's representation, it has not been good for them. Why are you going after the vulnerable in this budget?
We don't think we are going after the budget, the vulnerable in this budget, Congresswoman. We think that we are trying to find reforms that make sense, that would improve the lives of the beneficiaries. I think one of the 2 points that I think are reflected in your comments that I do want to get to. I think it's fair to say, why are we always looking on the mandatory side? One of the reasons I've been trying to have a conversation with the members on this side of the aisle is that we think that non-defense discretionary spending is an area where we need to do our best to continue to look for efficiencies and get rid of wasteful programs.
Well, reclaim my time, if I might, and I appreciate the interests of engagement. Let me make it very clear as I end. This budget attacks the most vulnerable in this nation. It is unequal in wealth. The tax scam is still the most powerful undermining of growth and prosperity in this nation by pushing money toward the top 0.1% or the top 1% and leaving those who can add to the economy along the highway of despair. This budget will not go. I yield back.
Thank you, Mr. Chairman, and thank you, Mr. Vogt, for being here. In December of last year, somebody made a statement that said this: the U.S. spent $716 billion this year. Crazy. Do you agree with that statement?
No, I don't agree with that statement.
You don't agree with that statement. And then in October, there was another statement that was made that said we need to, quote, get rid of the fat, get rid of the waste. And a suggestion was made for a defense budget of $700 billion, which would have been a 2% cut over the previous fiscal year. Do you agree with that proposal?
I remember the conversation that we had in terms of developing the defense budget for this budget, where we...
Do you agree with that statement that the defense budget should be cut by 2% and that we should get rid of the fat and get rid of the waste? Yes
I
or
certainly
no?
agree that we need to eliminate the fat and the waste. I don't
So
agree
you
that
agree
we
with
should
that?
have a reduction of 2%.
Okay, so you have just disagreed with the President of the United States. Both of those statements were made by Donald Trump. In December, Donald Trump tweeted, the U.S. spent $716 billion this year, crazy. And then in October, Defense News reported that Trump told the cabinet to, quote, get rid of the fat, get rid of the waste, and suggested a defense budget of $700 billion, which would have been a 2% cut over the previous fiscal year. Strange support, bipartisan support between what President Trump said and what some of us have been saying for some time. So, Acting Director Vogt, how much did the President cut total national defense spending by in his 2020 budget, the budget you have before us today?
We are increasing the budget by 5%. And can I respond to the comments the President made?
No, let me just go through, and if I have time at the end, I would like to have the chairman give you the opportunity. So you actually are proposing an increase of 5% to DoD spending, not a decrease of 2%, which is what the president said he wanted in October. And did non-defense spending also go up by 4.7 or 5% in your budget?
No, it did not. Non-defense spending went down by 5%.
I have that it was cut by 9%, but is it 5%?
It is 5% from the fiscal year 19 discretionary cap level.
So overall, the cut is what?
Overall, it's a larger cut. It's
Which
5%
is what?
from the cap level.
What is the overall cut to non-defense discretionary spending?
Well, if you include all of the gimmicks that Congress uses to hide the cost that the agencies spend at, that is much higher than...
Do you know what it is? What is the
fiscal
number?
year. We have roughly about an average 10%.
Double cut of the increase is 5% for defense, and the cut is 10% of non-defense discretionary, which, by the way, is education, healthcare, a number of other critical priorities. Now, let me ask you about OCO, which we call the slush fund. Mick Mulvaney, your boss, who's now serving as the president's chief of staff, referred to the Overseas Contingency Operation funding as a slush fund. He agreed with us then, back when he was in Congress. And the House Armed Services Chairman Smith has also called OCO a slush fund. And so let me ask you, in this budget, how much does the president propose cutting the Defense Department's slush fund in fiscal year 20?
We propose increasing the...
How much are you proposing to increase it by?
Increase it up to from $69 billion to $164 billion.
So you're proposing to increase a slush fund that has been called that by the President's Chief of Staff and by our Chairman of the Armed Services Committee by 138% to $165 billion over 2019. Now, I want to ask you, you made a statement earlier in this hearing. You said the National Science Foundation doesn't need to be immune from waste, fraud, and abuse, correct?
I said that the National Science Foundation is not immune from waste, fraud.
Is not, okay, doesn't need to be, is not immune. So let me ask you, do you think that the Defense Department should be immune from waste, fraud, and abuse?
I don't know.
Okay, and do you know when Congress mandated that all government agencies, including the Pentagon, should undergo an audit? Do you know when that happened, what year?
A long time ago.
It was 1990. It was
finally
1990, almost 3 decades ago. And tell me, Mr. Vogt, when was the first audit, comprehensive audit of the Pentagon done?
This year, under this.
This year. So almost 30 years later, we do an audit of an agency that has a $716 billion budget right now. You're proposing a significant increase. And how many of the 21 individual audits that were part of this comprehensive audit of the Pentagon, how many of those failed? So where did the Pentagon just fail all these audits? Do you know, out of the 21?
Off the top of my head, no, but I'm sure you do.
14 out of 21. So 2/3 of all of these audits failed, and in fact, 2 just received a passing grade. And auditors estimated that the Pentagon made improper payments, that's their term, which is not necessarily fraud, but it is payments that lacked sufficient or appropriate documentation or approvals, which means we have no idea where that money went, of $957 million in 2017 and $1.2 billion in 2018. So let me ask you, Mr. Vogt, do you think that we should continue to increase the Defense Department's budget when we have no idea where that money is actually going and the Pentagon can't even pass an audit and in fact didn't even do an audit for almost 30 years?
Congresswoman, we think that one of the promises kept of this budget is that we're the first administration to actually comply with the statutes of Congress to actually do the audit. And that
Well,
it's a
that's
work in
good,
progress.
and hopefully you take that on before you ask for more money. Thank you, Mr. Chairman. I yield back.
The gentlelady's time has expired.